So in this video, I'm going to talk about another famous Nclex topic where you will be tested a lot of questions. So this is about peripheral arterial disease, one of the most common topic for Nclex, right? So at this time, I'm gonna show you 4 questions on the screen and pause the video and try to solve yourself. You may not be able to get your right answer at this time, but for sure at the end of the video, you will be able to tell all your answer correctly if you watch video till the end, right? So if you understand this content, you will be able to tell your answer correctly when you see question about peripheral arterial disease, right? So what is peripheral arterial disease? So peripheral arterial disease also known as PAD, right? PAD means when the blood circulation is not reaching to your lower extremity. Let's say blood supply food to your whole body, right? So when the blood is not reaching to your lower extremity in your legs because of circulation problem, that's what we call peripheral arterial disease. It is reaching there, but the way it's supposed to get there like freely, it's not getting freely, that because your blood vessel arteries are getting narrowed like this, so that's why the circulation get cut down, right? So why it happens? So there are few main common causes are, first is smoking, right? So smoking will damage your blood vessel and that will promote atherosclerosis. So that's mean, what is atherosclerosis means? So that's mean a plaque will build up. Plaque means fat will build up in your arteries, right? And that will cause narrowing of your blood vessel and it will reduce the blood flow to your extremity. So that's the number one cause, smoking. And the second thing is age. Age means as we get older, our veins or arteries, they don't dilate like before, and in timely they get narrowed like this, right? So that's another thing. And the third thing is hypertension. So those people who have hypertension, high blood pressure, that will also constrict your blood vessel, so that will cause peripheral arterial disease, right? So just imagine if the arteries are narrowed, right, and the blood is not passing through, what gonna happen next? So just imagine your lower part of the body cell, they are looking food. If they are getting food, they are happy, right? But if they are not getting enough food, what's gonna happen? Then it will cause ischemia. Ischemia means the cell start gonna die. That's called tissue death, right? As I mentioned, the blood is the food for the whole body, right? And also the heart will pump oxygenated blood, right? It has all the energy, right? So once oxygenated blood start pumping to your lower extremity, if it's not reaching there properly, of course the tissue will die, right? So what signs and symptoms you gonna see in lower extremity? That's the main thing they could ask you, right? So first sign and symptoms, if the blood is not reaching to your lower leg, if there is a blockage there, then as you know, the blood is warm to touch, right? But if the blood is not reaching to your lower extremity, what's going to happen? You will have cold feet, right? That's the first thing you will see. You will also see leg pain while walking, right? Also known as intermittent claudication. That's mean you will have pain while doing exercise or walking, but if you rest your body, the pain will disappear. That's called intermittent claudication. This is very important thing. They might ask you this question, and you must know this word. Intermittent claudication means the pain occur while doing activity or walking, and it's go away while you're doing rest, right? Third thing, if the blood is not reaching to your lower extremity, then you will have slow healing leg sore. And as you know, if the blood travel to the body, we see the red skin, right? But if the blood is not reaching there, then what's going to happen? You will see discoloration of the feet. The color is going to be different, discoloration of the feet, right? Also, you will see weak pulses or absent pulses. Just think about perfusion issue, right? The heart is pumping though, so you must feel the pulse, but it's gonna be weak pulse or absent of pulse because of perfusion, because your heart is still beating, right? Another thing you will see, as you know, the blood is warm, but it's not reaching there. That means you will have cool temperature of your lower extremity, right? Another thing, you will see hairless, dry, scaly, thin skin as well. And why it happened? Because the blood is not providing enough nutrition to grow or flourish, right? So cells, they are very hungry and they are dying. So this kind of symptom you will see there. So once the tissue they start dying, you will also see a gangrene, right? The black discoloration of the that part. It could be thumb, the toes, or anything could be. And so what's gonna happen, if that part is dead, the doctor has to cut down that extremity or that part, right? So gangrene is very important in PAD. And very important thing, the Nclex will test you about the positioning of the PAD. So very simple. I should mention this in the beginning, but it's very simple. That so you tell the patient, see, there are two things you need to know. One is peripheral arterial disease, and this is combined with second, which is peripheral vascular disease. They both are like friend together, right? PAD and PVD. Or also third thing is deep vein thrombosis, DVT, right? So, but remember, PAD and PVD both are friends. They are working to, they are like together. But peripheral PAD means that you are having arterial problem in your lower extremity, right? And peripheral vascular disease means instead of artery, you are having problem with veins. Now the veins, there is a narrowing of the veins. There is a disturbance in the vein, not the arteries. So they are very similar, but instead of arteries, their problem is in the vein. So peripheral venous disease, that's mean the blood is reaching to our lower extremity, right? There is no problem to reaching there. But the problem is the deoxygenated blood not coming back up, not coming back up the way it's supposed to come back. So it's not suctioning well. There is a vacuum problem. So that's mean the patient, all the blood, there is a pool there now. So the patient legs is gonna be swollen and the warm to touch. You get it? You get my point, right? So in future I will discuss about peripheral vascular disease, but the main thing I already mentioned you, right? So this is vice versa, opposite. Arterial means the blood is not reaching there, and the vascular means the blood is not going upward, backward. So that means all the blood is in the lower leg, which will cause edema or warm to touch, right? Which I will discuss about later on. So now let me tell you two main position, as I mentioned already about PVD and PAD. So very simple, peripheral arterial disease, right? This is my A, PAD. So A means you will tell the patient to dangle your legs. Keep your leg dangling, because the more they're gonna elevate their leg, they're gonna have sharp pain. So in the night time, as they elevate the leg, they will have sharp pain, right? So tell your patient PAD means this is my lower leg, right? So that means dangling the leg. That's the positioning of the, they can ask you during an Nclex, a patient with PAD, what's the positioning? Tell the patient to dangle the legs. And if they ask you question about PVD, V means up. So this, the both leg go up. Tell the patient to elevate their both legs. Also third thing, as I mentioned, DVT, you also tell the patient to elevate legs. So V means both leg going up, PAD, both leg dangling, right? Very important thing you need to know, and very simple. PAD leg down, PVD leg up, DVT leg up. So you can get points very easily, right? So that's the wrap up of peripheral arterial disease. And now let's do another 6 question or 5 or 6 question, and you see you will be able to crack this answer immediately. Let's practice. A client report experiencing leg pain while walking that improve with rest. The nurse should suspect which peripheral vascular disease. So if somebody is having pain while walking and with the exercise but improve with rest, what we call that? That's a famous sign for peripheral artery disease, PAD. Answer B, right? A nurse is teaching a client about contributing factor to peripheral vascular disease. The nurse explained that most common cause of peripheral artery disease is, so three very important common symptoms are smoking, age, and what? Hypertension, HTN, right? So in this one, the answer is answer A. See how easy it is now to solve the problem. A client with peripheral vascular disease, supposed to be peripheral arterial disease, report experiencing pain in their legs that occur with walking and is relieved by rest. The nurse recognized this symptom as, that's what we call intermittent claudication, right? If you're having pain while exercise or walking and relief with the rest, that's called intermittent claudication. So that's your answer. A client with peripheral vascular disease or PAD report experiencing numbness and tingling in their feet. The nurse should suspect what? So as I mentioned, peripheral arterial disease is problem of the artery. So answer A is your, because it's a arterial problem, right? Not the venous. Venous means that would be peripheral vascular disease problem.